The more we learn about the coronavirus, the more treatments improve and fatality rates drop around the world, the more we see how this country has overreacted. We've done incalculable damage to our society and economy in order to manage a relatively modest health risk that, as looked likely back in February, might always have been better dealt with by pulling out all stops to protect the vulnerable, to ring-fence aged care homes and support the elderly rather than crush society. Have a look at these graphs from the National Health Department. The first one shows cases by age and gender, and it shows kids are not heavily affected, but that adults from their 20s through to their 50s make up the vast majority of cases as they get out and about in workplaces and the like. But when you go to deaths, they're almost non-existent until you reach people in their 60s. And of course, the majority are in their 80s and 90s, and the vast majority of them are already in aged care. Indeed, if we look at what infectious diseases expert Professor Peter Collignon tweeted today, it emphasises the point. The estimated infection fatality rate, that is the percentage of infected people who die, is close to zero for children and younger adults, but rises exponentially with age, he points out, reaching 0.4% at 55, 1.3% at 65 years of age, 4.5% at 75, and way up to 15% at 85 and above. Now, none of this, of course, is to devalue a single life or downplay the risk to the elderly. In fact, the point is just the opposite. We should have been doing less to harm society and hurt the young and more to protect and support the elderly. But that's not how Victorian Premier Daniel Andrews sees it, as he continues his siege mentality, exhorting Victorians to keep bunkering down with him.
We had a very different Mother's Day. We're about to have a very different Father's Day. We've got to stay the course on this so that we can have as close to normal a Christmas Day as possible.
73 cases today. Fewer than 10% of cases require hospitalisation. Anything up to half suffer no symptoms. And 90% of those who die have comorbidities, heart conditions, respiratory problems, diabetes and the like, conditions that make them more vulnerable and mean that they should be getting greater protection and more vigilance from our health system and aged care system. In this context, it's important to listen to Victoria's Chief Medical Officer explaining last month how deaths are counted against the COVID toll, even if the virus is not the cause of death.
For deaths from coronavirus, anyone who's a confirmed case who dies is classified amongst coronavirus deaths. So it doesn't have to be definitively from coronavirus. And in some instances, in aged care, there would have been some residents who were already receiving palliative care who became infected with coronavirus. So it's not definitive about whether they've died with or from coronavirus. I think it's fair to say that coronavirus is a very serious infection in anyone in aged care, but for classification purposes and reporting purposes, that's the definition.
The more we know about this disease, how it behaves, how we can combat it, and the mistakes we've made, the more it's clear we need to open up more, like Europe and North America, and learn to live with the disease. The Prime Minister doesn't want to go too far or too fast, understandably, but he knows the states are not moving quickly enough.
We cannot resign Australia to being a dislocated nation under COVID-19, Mr Speaker. What we must plan to do is by Christmas, Mr Speaker, we must work together to ensure we have the protections in place to protect the health and safety of Australians and to open up our economies and ensure the ambitions of our federation are returned to again and they are not resigned as a victim to the coronavirus, Mr Speaker.
Yep, Australia bunkered down early to put ourselves in a good position to dictate how we could live with this disease. Well done to the federal government and all the states for doing that. That was a job well done. But since then, too many of our leaders have forgotten how to come out of this. Only New South Wales Gladys Berejiklian and Scott Morrison seem to get it. The others like the power trip. They can't think past the infection counts. And sure, they're popular for now. But eventually the public will see what they've done and they'll see that the virus is still around. And then the reckoning. could be very dramatic indeed.